it's CJ. Did you know that 80%, 4 out of 5 pregnant women report problems sleeping, and that a lack of sleep during pregnancy can actually increase your risk for high blood pressure, fetal growth restriction, and postpartum depression? Which is why today I'm going to tell you the 7 most common reasons that you might be having a hard time either falling or staying asleep. I will also let you know some things that you can do to help make these symptoms better and maybe give you a better night of sleep. Number 1, everything hurts. You have lower back pain, pelvic pressure, round ligament pain. You also have a tiny human who decides to kick you all night long. So what can you do about it? I recommend making your bedroom a nice, comfortable space. Make sure it's dark, quiet, and cool. Once you get into your second trimester, try to sleep on either one side or the other. A pregnancy pillow can help. If you don't have one of those, putting a pillow between your legs and another one underneath your tummy can help. If you cannot sleep on your side, it is okay for you to sleep on your back as long as you have a wedge underneath one hip or the other. You don't want to be lying flat on your back once you get into that second trimester. Number 2, because you're uncomfortable, it can be really hard to relax. So here are some things that I recommend. Try to get some light exercise and don't nap for more than 30 minutes during the day. Have good sleep hygiene. Try to go to bed at the same time every single night. Take a nice warm shower or a bath before you go to bed. You can even ask your partner for a massage. If you're going to ask for a massage, however, make sure that everybody's on the same page. Sometimes a massage is going to lead to something, and sometimes it is not. Make sure that you put your cards on the table before you ask so that nobody gets butthurt. Number 3, your brain just won't shut itself off. You can fall asleep no problem, but you wake up at 2 o'clock in the morning and your brain is going a mile a minute. So here's what I recommend. Don't do anything that's going to stimulate your brain. No caffeine for 8 hours prior to bedtime, and when you are in bed, try not to watch your TV or look at your phone. The blue light in the screens actually tells your brain to stay awake. Number 4, relentless heartburn, especially once you get into the 3rd trimester. As your uterus is growing, your stomach capacity is getting smaller, and you actually have more stomach acids. So here's what I recommend. Try to eat 6 small meals instead of 3 big ones. Avoid foods that are greasy and or spicy. Don't lay down for 2 hours after you've eaten, and if all else fails, talk to your OB provider about pregnancy-friendly medication that can help with that indigestion. Number 5, you are having to get up to go to the restroom about every 20 minutes. That's because you've got a uterus that's pressing on that bladder. I recommend restricting fluids for 2 hours before you go to bed, no more than 1 glass of water. Number 6, problems with your legs. They're either cramping or they are restless. If you're having leg cramps, stretching exercises, extra calcium and magnesium in your diet, you can try taking a warm bath with Epsom salts before bedtime, and if all else fails, talk to your provider about using a magnesium supplement. If you are struggling with restless legs, try getting light exercise during the day, a warm bath or cool compresses before bedtime, and consider eating extra iron in your diet because anemia can really contribute to restless leg syndrome. Number 7, you might be a lot more worried or anxious than you normally are. If you have a history of anxiety, pregnancy certainly doesn't make that better. Here's what I recommend. If your symptoms are mild, try engaging in relaxation techniques, breathing, meditation, yoga. You might want to listen to soft music or have white noise while you're trying to sleep. If your symptoms are more bothersome, you might want to talk to somebody, a friend, your partner, or even a counselor. And if all else fails, do not hesitate to take medication that is pregnancy friendly to help with your symptoms. I do hope that this information has come in handy, and if you have any questions, you will leave them in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button and or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, You know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.